Dear students, today we'll discuss a congenital entity where it's often called as local gigantism. Let's see what is this condition is. Look at that, fourth finger, so big it is. Length and width, that is called gigantism. See that? Gigantism. See that? Gigantism. Local gigantism it is called as. Otherwise it is congenital arteriovenous malformation of fourth finger with localized gigantism. So here it is can occur in the only one part or entire limb will be involved. Many limbs may be involved. It may a congenital malformation can occur inside also. It is a congenital entity by birth and may progress also sometimes. And a large one may cause hyperdynamic circulation with the congestive cardiac failure also. Gigantism is very common because there is more perfusion to the limb too. So during development period, bone will get because of the more blood supply, bone, muscles, soft tissues will get larger than the other part. So there will be more length. Suppose the entire limb length will be more than the other side, and it will be warmer. There will be continuous thrill and murmur while auscultating. Bruise will be there, continuous murmur, and entire limb it will be there, and bluish discoloration will be there. Sometimes the pulsation will be able to feel, and that is the and warmness will be there and bleeding tendencies. If there is injury, lot of bleeding will occur. So any trauma increase on cause increase the bleeding. So that is the congenital arterial malformation. It's a very typical look. Only 1/4 finger is involved here, unlike many times entire limb, part of the foot or leg, hand, entire hand will be involved. So it's an abnormal communication between artery and vein. It's a congenital or acquired. It may be high flow, more than 800 ml, or medium flow between 400 to 800 ml, or low flow between less than 400 ml. So hyperdynamic circulation, cardiac failure. So this bleeding tendency, bleeding diseases because of the trauma, because of hypervascularity, bleeding may not be able to control. So that's what exactly may happen. And gigantism, cosmetic look. And these are the different problems in these patients. Do a Doppler, will be able to identify in a non-invasive method. Do a angiogram, dynamic CT angiogram, will be able to find out where exactly the problem. And of course, treatment is you have to do a embolization, therapeutic embolization through through angiogram. Usually vascular surgeons will do, or intervention radiologist can do that. And unless it causes problem, then you may have to do amputation of that part, remove the toe, finger, toe, or part sometimes, depending on the situation. In the lower limb, there will be always varicose veins also because of hyperdynamic circulation. Increased venous return causes the varicose vein. So varicose vein is a common association or presentation of the congenital malformation, especially in the lower limb. So all these things are there in my service manual of surgery in vascular lesions. You can always please go through that. Have that book, everything cover that. It will be helpful to you. Different photos are there. And remember, how we classified physiological changes, I already told. Anatomical changes is gigantism. And the complications are thrombosis, hyperdynamic circulation, bleeding, and congestive cardiac failure are the different complications. So it's very often asked as a short note. Short case may be kept in the exam. So it's very common thing which you have to remember. MCQs can be asked in congenital in different AV malformations, AV fistulas or AV malformations. So you can always go through my manual, which gives everything about it. Even clinical method book gives the different photos also for your understanding purpose. And students, please subscribe my YouTube channel for better understanding of the subject, where day to day, daily, small brief lectures are there of 5 to 10 minutes. And also like it and share with your friends and colleagues. And also join for regular live sessions once in a week or 2 weeks with 1.5 hour interactive session where students will present different cases and discussion with the clinical applications, analysis, diagnosis, and management aspects not only with me, also with the senior professors. So it will be very useful. Also, will get a if you join live session, you will get a certificate for that. Will be very useful for you. So students, go through the MCQ. Branham sign is seen in A, B, C, D. Find out right answer. I will acknowledge your answer. Quadruple ligation is done in again A, B, C, D. Find out the right answer. I'll acknowledge your or appreciate your right answer, please, in the comment box. Students, quotation of the day is: a door is larger than a lock is larger than a key, but the key is the smallest one has the entire power to unlock the house. Thus, a small and thoughtful solution can solve major problems. Very thoughtful quotation, which is very useful for you. So, students, it will help. How exactly your thoughtful thought process is important to open the entire analytical or entire system as such. That's what exactly it meant. Again, I request students, please subscribe my YouTube channel, like it, and share with your friends and colleagues. So students, I hope you understood this lecture very well. Thank you so much.